we've identified 24 action plans, strategic actions that will allow us to get there. And some of them are going to be hard to work through, but I know we have it in us. And so I'm excited to work with you in achieving these. And let me just share with you some of those. Many of them are around those efficiency, around that FTE, and around increasing patient-weighted work and being most productive. Some of those are some deep dives that we're doing within radiology, within ED encounters, within laboratory, and with administrative FTE. All those are efficiency, and some groups are already starting that. We're going to maintain the 4-2B closure of beds due to COVID right now and the combination that that's having over in Topeka in the CLC. We'll reassess as COVID goes beyond, and we'll see where we are. We want to increase productivity in all our areas, and that means you involved of how many patients should be seen in a clinic and how many appointment slots do we have. We're going to maintain our domiciliary with single occupancy, again through COVID, and then we'll reassess once again what we may need to do. We are looking at making sure that we can take care of all the patients in Eastern Kansas within our 2 main hospitals, but also within the CBOCs, the clinics. If we can't, and there's also distance issues for our veterans, we want to use community care, and we'll continue to strengthen those partnerships that we already have. But if we're able to take care of them, we want to bring them here and keep them here. Again, our veterans trust us with their healthcare needs. We want to make sure, as I said earlier, completing those encounters, decreasing FTE. We are going to be consolidating general surgery to Leavenworth. We're going to be closing the gym and the swimming pool and the building, minimize FTE across our campuses, specifically as we look at recreation therapy as different changes occurs. Fresh start, we're going to look to consider whether that should be consolidated, continue as is, or close. Our specialty clinics and our CBOCs, we want to take services to our veterans. Moving PT out there, or having a general surgeon go out there for half a day. These are just some options. We're going to be looking at those, and I ask you to help us out with that. We're going to be decentralizing timekeeping back to the services. And we were there a few years ago, and we went in this direction, but we're going to be changing that. The Topeka ED will become an urgent care center. Consolidate CLC to Topeka. Looking at our medical surgical beds, we have them at both campuses. Is that the right thing to do at this point in time with where we are? Establishing an ambulance transportation system. So as we make some of these decisions, that we can transfer our patients between campuses much more easily than waiting for an ambulance from the community. Consolidate the current clinics that are in Southeast Kansas to one clinic, and that's already in process. Now, you may be asking yourself, wow, what a change. And these are changes, and we've got to move in this direction of how do we make this happen. I have some dates set about the plans of how we go about doing this and when we go about doing this in this fiscal year. When do we need to do this to be able to put Eastern Kansas back on that plan of being most efficient, productive, and continuing to meet the needs of our veterans? Now, some of these things will need higher level approval, and I know that. But my vision director have heard what we're doing, and I've encouraged him to come back with me and talk with me if there's some concerns, and I know he will. But as we go forward, we're going to put those plans forward for the approval. I tell you why we really need this. Because if we don't, someone else will come here and say what Eastern Kansas is going to be like. And I feel that you and I, who have served our veterans here in Eastern Kansas for so long, will make the best decisions that they need. It's going to be hard, but all of us together can make a difference with it. So I'm excited to be with you, walk side by side as we go through these difficult times, as we have this past year. But our veterans love what we do because they receive great care from us every single day. We are just ready to step it up, change us a little bit, and be ready in a few years as we make these changes to be able to capture additional dollars that will allow us to enhance the services that we even provide to today. So let me share with you when I came to this organization 8 years ago. It's hard to believe it's been 8 years. We've been through a lot, quite a bit, but every time you have stood up. I think about our home-based primary care staff in the community as I've taken a visit with them and talked with veterans out there and seen the work that the staff do. As I walk through the halls here and people call me by name, I know that you're committed to serving veterans. And that's what really is important to me and my heart, is that we are serving veterans. And so I know as we go forward together that our veterans are going to continue to come and take care of their needs. Their trust levels is going to be as high as ever because it's been that way in Eastern Kansas. And so I've seen that as I've walked those halls, as I've been in meetings with you, as I've listened to you. And so I can only expect that it's going to continue going forward. So be ready. Thank you for all you're doing. I can't wait to continue to be the leader of this organization.